Blog Talk Radio.
Welcome to iboradio, all of our listeners. This is Peter Frank, and the purpose of today's session will be interviewing ibogaine providers or people who have experience with ibogaine who are doctors. And we're going to speak to two people. One is Dr. Eugene Schofield, who's here in the U.S. in San Francisco, who has a long experience working with psychedelics. And then the second doctor is Bruno Rasmussen, who's currently down in Brazil. And between the two of them, they should give us a perspective on what ibogaine looks like from the medical community, and since they're both in two different countries operating under two very different regulatory frameworks, we should get a good perspective on the different ways that doctors work with ibogaine. So the first person is Eugene Schoenfeld, and he is a psychiatrist. He got his MD from the University of Miami, and he's well known in the Bay Area for his radio show and his column, Dr. Hip Pocrates, in which he would answer questions for people about issues relating to psychedelics and sex. And this was during the sexual revolution in the Bay Area in the 1960s. And he really has a wealth of knowledge about psychopharmacology. And so I think we'll bring him on now, and I'm really anxious to see what he has to say to us. So let's bring the doctor on.
Hello.
Hi, Eugene. So, in your own words, why don't you tell our viewers how you got interested in psychopharmacology?
Well, I had an opportunity to travel and study in Gabon, West Equatorial Africa, beginning when I was a medical student. And the last time I was there, beginning in 1965, I was introduced to one of the native doctors in the area. He was I was based at the Albert Schweitzer Hospital in Gabon, near the town of Lambaréné. The hospital was known as Lambaréné as well. The native doctor that I was introduced to, Ngoa Michel, was a patient at the hospital because he had arthritis. But sometimes the hospital would refer patients to Ngoa Michel when they had what seemed to be psychiatric problems that they were not able to deal with. And I learned that Ngoa Michel and other native doctors in the area were using the drug ibogaine. They were using it not as the extracted drug, but from the plant. The plant is Bwiti Iboga, and it's a bush, and the most active part of the plant are the coverings of the roots of that plant. So I was very interested in this matter because shortly before my last visit to the Schweitzer Hospital in 1965, I had an opportunity to use LSD. At that time, LSD was still legal. So naturally, I was interested in the effects of psychedelics.
Okay.
And when I learned that Iboga was being used near the Schweitzer Hospital, I started spending a lot of time with Ngoa Michel and observing his ceremonies and participating in them. He also took me to other native doctors in the area who were using Iboga in their treatments.
And so at what level were you participating? Could you tell us a little bit about that?
I was invited, for example, to take part in a ceremony treating a fellow who was having trouble finding a wife, finding work, and in getting along with his neighbors. The ceremony, takes place over 2 days. and it starts with taking the plant matter, taking the covering of the iboga roots off, and then boiling the roots, which makes it, what's left makes a kind of a soup.
Mm-hmm.
And the patient, or the person participating in the ceremony, starts ingesting the root coverings, and because it's plant material, there's quite a bit of matter that is expected to be ingested, and it's over a period of time. There were like piles of plant material on the skins of civet cats, which were also in the area. And this started early in the morning.
Okay.
The native doctor that I knew seemed to use a combination of Catholic ceremonies and his native ceremonies. He had learned his skills from his father, who was also a native doctor.
Okay.
So over the course of a day, the person would ingest the iboga plant material, and then that night there was a very elaborate ceremony which began at midnight, and it was timed so that there was no moon. It was pitch black, and the ceremony was arranged so that there was a long line of cleared earth that led up to one of the huts, the ceremony huts. Suddenly, it was pitch black, and then there were the sounds of animals. Some of the participants in the ceremony were imitating the sounds of animals in the forest, and crocodiles, for example, and lions. And suddenly there was a light far in the distance. They had lit torches, and then fires, and a group of dancers came leaping over these fires toward this elongated ceremonial hut, holding torches, sending sparks flying everywhere, and dancing and chanting coming into the hut. The patient would be sitting in the hut. Now, by this time, he was well under the effects of the iboga plant. And, one can imagine, anyone who's had an experience with psychedelics, or not even with psychedelics, just imagine being in the forest and having these elaborately costumed dancers. They would design costumes out of palm fronds, and dancing through the hut, sending sparks flying everywhere. The air was filled with sparks from their torches. And this would go on for several hours. In that way, it's hard to describe in words. What this was seen, but imagine this is now on the equator in Africa.
Well, let me ask you a question about this, because it's something that's always interested me. I've seen a few videos of these traditional ceremonies, and they seem just so intense. I mean, for an American, we're used to living in our own room and spending a lot of time watching television or reading books by ourselves. To be on a powerful psychedelic and to have dozens of people running around in a room with you while you're completely gone on a psychedelic, to me it seems the most terrifying, unpleasant experience imaginable. But I was wondering if perhaps the feeling for somebody who'd grown up in a village, if this would seem normal to them, because they would actually know who these people were, and even though they were wearing masks or paint, these are their childhood friends, right? And they're used to living in a hut with lots of people and activity. So did the person there seem really uncomfortable, or how did they seem?
No, he seemed quite comfortable, and the native doctors. I mean, we used to call them witch doctors, which conveys something frightening. But they're native doctors, and the native doctor I knew best was a kindly, older man, very friendly, with a very warm smile and presence. This ceremony that I'm describing, and the patient, I'll call him, the patient was quite comfortable. Although, of course, yes, I mean this was a very dramatic ceremony, but not at all frightening to people who were accustomed to the ceremonies there. It was not frightening at all.
Okay. Okay. So then what happened as the ceremony progressed?
Well, this went on for hours, and then at one point they brought out a chicken. They were going to sacrifice a chicken. They asked me to leave. At that point, the native doctor takes a little bit of the ibogaine, as did I, but not enough to have a psychedelic effect. And later I want to talk about some of the sub-psychedelic doses that have been used in the past with ibogaine.
Okay.
So this ceremony went on for hours, until dawn. The person was quite affected by it, and he seemed helped by it. Later, as I said, I had recently taken LSD, before going to Gabon on that last visit. I had taken a little LSD with me, and the witch doctor, the native doctor, Ngoa Michel, and I had a chance to administer the LSD to one of his patients later, and Ngoa Michel said, "Well, it's pretty good, but not as strong as our Iboga." But of course, we know about set and setting. And certainly the setting for an Iboga ceremony is very dramatic. Not something most people have the opportunity to experience.
Right. Okay.
Also the LSD was used on an individual who had recently taken ibogaine, so there might have been some cross tolerance. So it's hard to know.
Okay. Okay, so that was the end of